Hello, everyone. Welcome back to our channel. Today, we are here to debunk the top 5 myths about PrEP. PrEP, which stands for pre-exposure prophylaxis, is a highly effective medication for preventing HIV transmission. However, there are still some misconceptions and myths surrounding PrEP that need to be addressed. In this video, we'll clear up the confusion and provide evidence-based information about PrEP. As always, remember that while we strive to provide accurate information, it's essential to consult your healthcare provider for personalized advice and guidance. Understanding PrEP. One of the most common myths about PrEP is that it is only for high-risk individuals, such as those who engage in multiple sexual partners or intravenous drug use. In reality, PrEP is recommended for anyone at substantial risk of acquiring HIV through sexual activity or needle sharing. High-risk behaviors do increase the likelihood of HIV transmission, but they are not the only factors considered when determining PrEP eligibility. Healthcare providers assess various factors, including sexual activity, condom use, and partner's HIV status, to determine if PrEP is a suitable prevention strategy. PrEP is an essential tool for individuals who want to take control of their sexual health and reduce the risk of HIV infection. Another prevalent myth is that PrEP provides complete protection against HIV. While PrEP is highly effective in preventing HIV transmission, it is not 100% foolproof. Research has shown that consistent and correct use of PrEP can reduce the risk of HIV infection by over 90%. However, PrEP does not protect against other sexually transmitted infections, STIs. So using condoms alongside PrEP is recommended for comprehensive protection. It's crucial to remember that PrEP should be taken as prescribed by a healthcare provider to maximize its effectiveness. One barrier to PrEP utilization is the misconception that it is expensive and inaccessible to those who need it. While it's true that PrEP can be costly without insurance coverage, several programs and initiatives aim to make PrEP more affordable and accessible. Many countries have public health programs that provide PrEP at reduced or no cost to individuals at risk of HIV. Additionally, some pharmaceutical companies offer patient assistance programs and co-pay assistance to help reduce out-of-pocket expenses for those with insurance. For those without insurance or financial resources, community health clinics and non-profit organizations often provide PrEP at reduced costs or on a sliding fee scale. Another myth that needs debunking is that PrEP is only for gay men. While it's true that gay and bisexual men are at higher risk of HIV transmission, PrEP is not limited to any specific gender or sexual orientation. PrEP is recommended for anyone who engages in sexual activity with a partner known to be HIV positive, has multiple sexual partners, or engages in behaviors that increase the risk of HIV transmission. This includes heterosexual individuals, transgender individuals, and people of all sexual orientations. The goal of PrEP is to provide an additional layer of protection for anyone at risk of HIV infection, regardless of their sexual orientation or gender identity. The final myth we'll debunk is the misconception that PrEP is only for young people. In reality, PrEP can benefit individuals of all ages who are at risk of HIV infection. Age alone does not determine PrEP eligibility, it's the individual's risk factors that guide the decision to prescribe PrEP. Older adults may engage in sexual activity or drug use that puts them at risk of HIV, making PrEP a valuable prevention option. It's essential for healthcare providers to assess an individual's risk factors and discuss PrEP as an option for HIV prevention, regardless of their age. In conclusion, debunking these myths about PrEP is crucial to promote accurate information and reduce barriers to HIV prevention. PrEP is a highly effective tool in the fight against HIV transmission, and it's important for individuals to have access to evidence-based information about its benefits and limitations. Remember, PrEP is recommended for anyone at substantial risk of acquiring HIV through sexual activity or needle sharing, regardless of age, sexual orientation, or gender identity. It's not a replacement for condoms, regular HIV testing, or other preventive measures, but rather an additional option for comprehensive HIV prevention. If you're considering PrEP, talk to a healthcare provider who can assess your risk and provide guidance on its appropriate use. Thank you for joining us as we debunk the top 5 myths about PrEP. If you found this video informative, please give it a thumbs up and share it with others to help spread accurate information about HIV prevention. As always, remember that the information provided here is for educational purposes only and should not be considered medical advice. Stay tuned for more content on health and well-being on our channel. Until next time, take care, stay informed, and prioritize your sexual health.